Thank you for listening to Depictions Media Radio.
Saludos, muy buenos días.
Greetings, good morning to all of you, and welcome to this press briefing here offered by PAHO on the COVID pandemic here in the region of the Americas this Wednesday, April 21st, 2021. My name is Sebastiano Liel with the Communications Department here at PAHO, and this session will be about an hour long, and we will be accepting your questions up to the end. We have already received your questions via email, and also you can send your questions live or through the Q&A button. Please remember to include your name and media outlet together with the questions. Let me remind you that we have simultaneous interpretation into English, Portuguese, and French, and that you can choose any of those languages by clicking on Interpretation. Today, PAHO's director, Dr. Carissa Etienne, will be reporting on the evolution of the pandemic in the region, the threat of infodemics, and also the importance of vaccination. Together with Dr. Etienne in this session, we have Dr. Jarbas Barbosa, PAHO's Assistant Director, Dr. Ciro Ugarte, Director of Health Emergencies, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19. And now I would like to ask Dr. Etienne to share her opening remarks. Dr. Etienne, the floor is yours.
A very good morning, and thank you for joining today's press briefing. In the last week, our region reported more than 1.5 million new COVID cases and nearly 40,000 COVID-related deaths. Over the weekend, the world reached a tragic milestone. More than 3 million people have lost their lives to COVID. And nearly half of these deaths happened right here in the Americas. Behind every death is a life cut short and the unimaginable suffering of families and loved ones. Their passing is a reminder that we must do more to protect each other, because this virus continues to be a threat in every corner and community across our region. Cases in Canada are still growing, particularly among young people in their 20s and 30s. And in the United States, infections are on the rise after weeks of declines. Nearly every country in Central America is reporting a rise in infections. Cuba, Puerto Rico, and the Dominican Republic continue to drive most infections in the Caribbean. And many smaller island nations like Aruba, Bermuda, and Curacao are reporting a rise in COVID-related deaths. The recent volcanic eruptions in St. Vincent and the Grenadines have led to evacuations, with thousands of people currently living in shelters. More than 137 COVID cases have been reported in shelters thus far, and we expect more new infections in the coming weeks. In South America, cases are accelerating in Colombia, Venezuela, Bolivia, and Uruguay. Argentina has also seen a rapid growth of new infections and has assumed the third highest case count in our region. The good news is that after strengthening public health measures, Chile has seen cases plateau, and after a difficult few months, Brazil is reporting a drop in cases, including in the Amazon region. But cases remain alarmingly high across Brazil, and certain municipalities have been quick to ease restrictions, so it is very likely that these trends will reverse. For more than a year, we have been inundated with news reports and information about this virus. Most of us have had a hard time keeping up. But science is a collaborative, evolving process, and researchers and doctors rely on shared information to learn from each other and to build our collective knowledge to prevent and treat this virus. Transparency is paramount, and that's why PAHO continues to host these press briefings to share the latest trusted information and to answer your questions. But not all sources are worthy of trust, and insidious rumors and conspiracy theories continue to spread, inspiring fear and costing lives. Today, misinformation is one of the most serious threats to our public health. Because unreliable information spreads quickly, PAHO is collaborating with tech companies like Twitter, Google, and Facebook to address fake news and to ensure that the public can easily find accurate information. But we all have a role to play in stopping these rumors from spreading online or in conversations. When we read or hear something that seems outlandish or impossible, it probably is. Before sharing something, we owe it to each other to check the source and confirm that the information is true. This is only common courtesy. And if you have a doubt, please don't spread it. Misinformation is most damaging when it fuels vaccine hesitancy. For more than 100 years, vaccines have saved millions of lives from infectious diseases and spared generations from diseases like smallpox, polio, and measles. Today, vaccines are helping turn the tide of this pandemic. Any vaccine or medicine can present side effects at a certain level. When national regulators license a vaccine or medicine, or when WHO grants a pre-qualification or an emergency use listing authorization, they weigh the benefits versus the risks. The vaccines delivered through COVAX have been thoroughly assessed by the WHO experts. The benefits of these vaccines in preventing infections, hospitalizations, and deaths outweigh the risks of side events. The reports of very rare, unexpected side effects and decisions by some regulatory bodies to conduct further analysis demonstrate one thing, that our surveillance systems are working. We rely on surveillance systems to see how medicines and vaccines affect populations so we can understand even extremely rare adverse events and adapt our strategies when needed. But we need to highlight that every person in a vulnerable group that is hesitant to get the vaccine can become part of the sad statistics. That is one of the thousands of deaths that occur daily due to COVID-19. Vaccines are saving lives now and will contribute to control transmission in the near future when we achieve high immunization coverage. In Israel, COVID-19 vaccines are already helping drive down infections. And initial data from Chile and some cities in Brazil indicate a reduction in hospitalizations among the elderly, thanks in part to COVID vaccines. Protect them. Let's all this as
to give priority to those countries that are the most in need and most vulnerable, such as in the case of Bolivia. Dr. Barbosa, thank you very much for the questions. I think that this also gives us another opportunity to talk about the COVAX facility. COVAX is a new mechanism, and there are always very questions as to the roles, how decisions are made, and how the lists of countries are developed. COVAX is led by WHO, CEP, and Gavi, and the countries participate in, for example, Colombia is part of the council. They are part of the governing body of this facility. And from the outset, the goal of this mechanism, of this facility, was to reach by late 2021 for all of the participating countries to receive at least 20% or vaccines, to vaccinate at least 20% of their population. From there, it was also established that the delivery to the countries should follow a list of countries that was established by following an algorithm based on a random allocation. And we are trying to have countries from all over the world, countries that are supported by the facility, and self-financing countries also in a with a balanced ratio. This algorithm was approved by an independent committee on allocation that was established with experts. And to create this country list, that algorithm is used, and that list is also a way to make sure that there was no preference based on a country or region. With that list, PAHO, by using the revolving fund to support the acquisition for the countries in Latin America and the Caribbean, starts to negotiate with the vaccine producers to have the quantities as soon as possible. So with this, we have already concluded the first round of all the countries of the region of the Americas that are participating in this COVAX facility. The first shipment was already sent that reached 29 countries. More than 4.2 million doses were already delivered. Today we are shipping additional 90,000 doses to Bolivia, so we are going to reach 4.3 million doses that have already been delivered, and then we start again from the beginning of the list. For example, 2 countries have already received the second rollout of vaccines, and we are also talking to producers so that other countries within the next couple of weeks or the last week in April or early May may receive the second shipment. So this is the way the facility works. PAHO cannot make any decisions on priorities. This is a decision made by COVAX with the support of participating countries. As to Bolivia is a country that is supported. That is to say, the COVAX facility has made it possible for 10 countries in the region of the Americas to be able to receive the vaccine without the need to pay for them. So 22 countries are supported all over the world and 10 in our region. So this is an important mechanism that COVAX, an important benefit that the COVAX facility is offering. That is to say, for those pre-qualified vaccines in those pre-qualified countries that will be receiving the vaccines without payment. We still have very limited access since producers are having some delays in their deliveries, but we continue to talk to them so that they can comply with the agreements signed and for the countries to have enhanced access to the vaccines needed in time. Thank you. Thank you very much, Doctor. The next question is by Enrique Lazo from Deutsche Welle, Melina Ochoa from UNO-TV in Mexico. We also have in our chat a similar question by Blanca Valadez from Millennium on the situation in Mexico. Enrique is asking what is the current situation of the pandemic in Mexico? How is the vaccination campaign moving along in Mexico? And Melina is saying that 10 out of the 32 states are not showing a downward trend in the number of COVID-19 transmission, and she's asking whether this is the third wave or an increase again in Mexico. And Blanca Valadez was asking something similar. So, Dr. Alighieri, thank you very much, Sebastian. Thank you to our colleagues from Mexico. Based on the permanent data that we receive from the Mexican authorities through the international health regulations, we are observing a slight increase in Mexico, a slight surge that has to do with the return from Holy Week and also the easing of the measures. Some states that had a high number of visitors, such as Chihuahua, Baja California in the south, are also seeing a plateau or an increase in the number of cases. It is important to mention that the rate continues to be high, as well as in the city of Mexico, with more than 70 cases per 100,000 inhabitants. The average number of daily new cases is about 4,500 nationally. As part of this information and as part of this context, we cannot lower our guard if we want to avoid an important increase in the number of cases in the upcoming weeks. We're also, with the support of the Pan American Health Organization, we're also continuing to carefully observe the circulation of SARS-CoV-2 variants for variants of concern and variants of interest. Now, as to the first question regarding the vaccination campaign, the information that we have received from the authorities tell us that 14.5 million doses have been administered, giving priority to health workers and also people older than 60. And we understand that in early May, vaccination activities clearly will be initiated for individuals between 50 and 59 years of age. I hope I have addressed those questions. Thank you. Thank you, Doctor. The next question is by Paula Dubias from the New Humanitarian. And in English, it is the following.
Access to health services in Central America a factor that has contributed to migration from the region? And how concerned are you about the spread of COVID-19 in the migrant population heading toward the U.S., considering the increase in their numbers since the start of the years as compared to recent years? Doctor Ugarte, ¿podría contestar?
Dr. Ugarte.
Thank you, Paula, for this question, because it applies to many other countries and also the context of migration. Migrants will leave their place of residency or their countries of residency for various reasons, particularly the socio-economical and political situation, the conflicts that they may have in those places, and also the situation of access to essential services, including, of course, healthcare services. And that has been a main driver for migrants in our region, but also in other regions. In that regards, when we see the lack of access to health services during outbreaks or emergencies or disasters, people tend to migrate to other places where they may have better access to health. But during COVID-19, because of the transmission in many countries, and also they are concerned that travelers or migrants may increase the risk inside the country, most of the countries implemented travel restrictions. So the travel restrictions during COVID-19 has actually reduced the number of migrants. And the situation is that many of them are stranded in situations that they could not live anymore. So in that regard, there is a complex situation for millions of people that cannot leave the places where harsh conditions are in place. And in that regards also, when the migrants are initiating the journey, they may also have, in addition to the challenges of restrictions on traveling, also the conditions during their journey that will increase the risk to get infected with many diseases. COVID-19 is one of them. And during the journey, but also at their destination, being this temporary destination or a stop, for example, or the final destination, where they may not have access to healthcare. And that increases the risk for those migrants. And at the same time, if the countries of destiny are not aware of those issues, it may also represent an area where COVID-19 is not properly controlled. So access to healthcare for migrants have been one of the priorities that the ministers of health in the Americas and also worldwide and the Compact on Migration have highlighted. And most of the countries have included the migrant population on access to healthcare, and it is the right way to do. Both providing healthcare so they can be detected, identified, well, the disease can be detected, identified, but also the proper treatment can be given to the migrants. And in addition, also to control the pandemic, we need to include all the populations, not only the international migrants, but also the internally displaced populations that in many countries actually are in higher numbers than the international migrants. Thank you.
Gracias, doctor. Me gustaría
Thank you,
que...
Doctor. Now I would like to give the floor to Jason Bouvier from NPR, the National Public Radio here in the U.S. Jason, if you are listening to us, please, you have the floor to ask your question.
The Wall Street Journal was reporting today about fake Pfizer vaccines being sold in Mexico. And I'm wondering how much of a problem you're seeing this throughout the region with false. Are you seeing other places where there are falsified vaccines being sold on the market? Thanks.
Gracias, Jason. Doctor Barbosa, ¿podría contestar?
Yes, thank you, Jason, for this question. Yes, we have received some information from Mexico, from Argentina, and from Brazil that some doses have been offered through social media, illegal markets to offer vaccines that probably are falsified vaccines. They are not real vaccines, or maybe they are stolen doses from a health facility that no one can assure that they were properly stored. So it's clearly a problem, not only a problem for the health authorities, but also for the police to identify this criminal activity. And also is important to give a clear message that everybody is concerned about the vaccine. The access to vaccine is limited. Now we need to ensure that the priority groups could receive their vaccines in order to protect their lives. And we only can rely on the vaccines that are provided by the health authorities, because these vaccines are guaranteed that they are safe and efficacious, and at the same time that they had a proper cold chain to keep their capabilities. So it's very important to refuse to buy, to purchase any kind of vaccine that is being offered through social media, to internet, using this kind of market to sell these vaccines. This is a risk for your health. Thank you.
Gracias, doctor. Siguiente pregunta.
Thank you, doctor. The next question is by Jenny Caballero from TVN Panama, and the question is whether the third and fourth waves of COVID-19 are imminent in the region. Dr. Aldiguieri. Could you please repeat your question? Yes. So Jenny Caballero from TVN in Panama is asking whether the third and fourth waves of COVID-19 are imminent here in the region. Okay, very well. Thank you very much for the question. It is short, but very broad question at the same time. For a year now, we have been using a mosaic of profiles of epidemiological profiles here in the region of the Americas, and that description still applies. There are marked differences between North America, South America, Central America, and the Caribbean, and sometimes within the same country when we're talking about a large country. As to the impact and the frequency of future waves, it is a complicated equation that is related to several factors. I am just going to mention some of them. First, the coordination with the governments regarding the implementation of public health measures, including also several weeks early before the alleged surge. Second, the observance by populations of those public health measures. Third, the preparation of health systems to accept more severe patients when waves are expected, including the strengthening of logistical supply chains and also medicines for urgent care, lab tests, and equipment. And finally, we have another factor that is becoming important and that also has an impact, and it is the inclusion of various variants of the SARS-CoV-2 that may also add to this. So this is a complex equation, and it should also be mentioned that the vaccine campaigns are at the core of these strategies, and we are not expecting an impact of those campaigns on the dynamic of the epidemic waves in the long and medium term, or in the medium and short term. What we have seen in those countries that have been very proactive with vaccination is a decline in the number of deaths among those groups that are the most vulnerable. So the regional situation nowadays is not favorable. For 8 weeks, even more, we are observing an increase in the trends throughout the subregions, North America, South America, Central America, and very few countries have not reported an increase. So to conclude, regarding preparation for potential waves in a concerning regional situation, public health measures that were proven to be effective in 2020 are still part of the tools we have to protect the population from the impact of the COVID-19 pandemic. I hope I have addressed the questions by our colleague from Panama. Thank you.
Thank you, Doctor. The next question is from Ariela Navarro from Cadena FP in English.
Are planning a vaccine passport, and many of these plans exclude Sinovac and Sputnik. Does this represent discrimination for peoples and nations in the Americas that do not have another choice to get these vaccines? Dr. Ugarte?
Thank you for this question, Ariela. Well, let me begin that saying that WHO does not recommend countries to introduce a certificate to prove vaccination against COVID-19 as a condition for exiting or entering a country, or boarding, embarking a ship or a plane. As per the temporary recommendations issued by the Director General of WHO on January 15th, but also updated this week on the 19th of April, the requirement or the policy of WHO is the same: do not require a vaccine passport. This is also in line with the provisions of the international health regulations. But on the basis of the evidence and global equity and access of COVID-19 vaccines, of course, if the vaccine is widely available in most of the countries, this decision may change. However, any future recommendations regarding the possible use of certificates with proof of vaccination against COVID-19 for international travelers will contemplate those vaccines that are included in WHO's emergency use list. So that is maintained by WHO, and that provision is open to any manufacturer that may want to register their vaccines in this emergency use list of WHO. And of course, the process is highly strict and with high scrutiny. So it is a process that will independent advisors, experts, etc., and then a decision is made to include those vaccines. So that applies, of course, with the vaccines that you mentioned. So therefore, the validity or recognition of such a proof of vaccination will be related with the EOL vaccines. But let me finalize with this. You mentioned discrimination. During the current context, actually, the vaccine passport in itself may add to discrimination for the people and the populations of the Americas, and in extension also for other countries. So we don't see this as a mechanism to limit the traveling of peoples in the Americas, because as we know very well, the access to vaccines in our region, unfortunately, is still very low. Over, thank you.
Gracias, doctor. La próxima pregunta.
Thank you, Doctor. The following question is from Bennett Roach from the Montserrat Reporter, and it's in English.
That the COVID-19 vaccines do not prevent the contraction or transmission of the virus. Doctora Etienne?
Thank you, Bennett, for this question. So let me begin by saying that the main goal of these vaccines is to help reduce serious COVID-19 cases, hospitalizations, and deaths. And for those purposes, the vaccines we have are very effective. But no vaccine is 100% efficacious. But even if vaccinated people could get infected, these vaccines reduce the chance of them getting the most severe symptoms and requiring to be hospitalized. Without the vaccine, however, they would be at great risk of getting sick or even dying. Meanwhile, PAHO, in close collaboration with national health authorities, we are tracking the rollout of vaccines and how it may affect the epidemiological situation. This type of evidence is really key to understanding the impact that vaccination has against transmission. Let me tell you that the evidence is still limited, but we expect to see an impact once there is enough vaccine coverage of the population. But we are not there yet. Most countries have vaccinated only a small percentage of their populations, and transmission is still very active. And therefore, this is one of the reasons why even vaccinated people need to keep observing the protective measures that we recommend. Use a mask, practice physical distancing, and wash your hands. Vaccines really work best when they are deployed together with the public health measures that are needed to keep the transmission down. The vaccines against COVID-19 work very well, and they will keep people alive, they will avoid hospitalization, and they will help eventually to end the pandemic. But really, until they are available for all of us, each one of us needs to do our part. Thank you.
Gracias, doctor Etienne.
Thank you,
Siguiente.
Dr. Etienne. The next question is from Katia Rojas Toro from Destino, Panama. And she says that in Panama, they're beginning to use AstraZeneca vaccine. And she asks, what's the real risk of suffering thrombi due to COVID-19 as opposed to the or in cases with the AstraZeneca or the Janssen vaccine are used. Dr. Barbosa, thank you very much. As the director has mentioned in her remarks, vaccines go through an approval process by regulatory authorities where the vaccines are evaluated for risks and benefits. And this is a part of a process, not only for COVID vaccines, but also for all vaccines and all medications. When there is an event that is unforeseen, which is the thromboemboli that have been seen in some cases with the Janssen, the JJ vaccine, as well as the AstraZeneca, well, they need to be evaluated, and these are very rare events. In the United Kingdom has a very excellent surveillance for every 250,000 cases of dose administered. When we compare the situation, there is a meta-analysis with 425 studies that were published in international journals, and they talk about the fact that the risk of venous thromboembolism for COVID-19 patients in general, for those who go to the hospitals, is about 21%. So 21 out of 100 patients. For patients with COVID-19 that go to the ICU, it is 31%. In other words, 31 out of 100 persons. So when we compare this with one case in out of 250,000 doses received, it is evident that the benefits outweigh the risks by far. And this is why the recommendation was made to maintain the use of the vaccines and to continue to do studies to clarify the link that may exist between the vaccine and these very rare cases, I repeat, extremely rare cases of thrombi, and make specific recommendations by professionals, by healthcare professionals. It's very important that vaccination continues so that lives may be saved. People that are getting vaccinated at this point in time in most Latin American countries are the most vulnerable groups, the elderly, the people with chronic diseases, and people who are more exposed as healthcare workers. So protecting these groups, it leads to saving lives because their risk of dying due to COVID-19 is a very significant risk. Thank you. Thank you, Doctor. We have several questions about Venezuela from Vivian Sequeira, from Reuters, Nicole Shakur from Bloomberg, Mariana Garcia, Crónica Uno, and Gabriela Bastidas from Monitoria.com. The first question is, please, could you confirm whether Venezuela has made the second payment to the COVAX facility? They want to know how much money it was, when, and what vaccines would be arriving in Venezuela. Dr. Ugarte, could you answer this question? Yes, of course. Well, the first payment has been confirmed. With respect to the second payment, we have references that it is underway and that Venezuela would be processing their payment to the COVAX facility, and we hope that this payment will be completed as soon as possible, taking into consideration the steps of the financial system. Once this second payment is complete, the agreement would be finalized with COVAX to have access to have access for vaccines for 20% of the population, that is 5.7 million people in Venezuela. So this process still continues, still underway. It's still in negotiations and dialogue. And there is also talk about what vaccine would be available to Venezuela. It depends on each one of the countries with which COVAX is allocating their vaccines. They need to continue with their internal approval processes, and then approval, the way of purchasing vaccines was changed. In other words, having to announce what the vaccine will be that they would want to receive in that case. But for that, they will need to make the advance payment. They have made the first payment. The second payment is in the process of being completed. Thank you. Thank you. And the second part of this question related to the strengthening of the cold chain, and they ask how much is the useful life of the vaccine, of the COVID-19 vaccine, once it is thawed. Dr. Barbosa, thank you for your question. It depends on the type of vaccine, and it varies. So what happens with those vaccines is that manufacturers do stability tests, 3 months, 6 months, 9 months, a year, 2 years, etc. So these stability tests help monitor on a continual basis the vaccines that are being delivered today for COVID-19. All of them have time to expiry, which is relatively short. These are vaccines that are going to be used during campaigns, so the use needs to be immediate. No country wants to store the vaccines to administer in 2022, for example. Secondly, that studies on the stability of vaccines are recent. We don't have vaccines that have been produced, say, a year ago to confirm that they're still ready to be used even after a year of manufactured. So it is very important to follow the recommendations for each single type of vaccine. When the countries receive, they have a date by use, and whenever there will be an update. For example, if the vaccine was released with 6 months, and now if there is more information, say that that batch can be active for another 3 months, then the countries receive that information immediately. So there is always contact between the health ministries, the regulatory authorities, in order to provide the different updates that are provided by the manufacturers according to the tests, the stability tests that they run in a standardized way for not only the COVID-19 vaccine, but for all vaccines that are used all over the world. Thank you. Thank you, Doctor. The next question is by Rosemary Bernal from Prensa Latina. And the question is, over a year, we've been under COVID-19 pandemic. And so her question is, who have been the people most deeply affected in the region of the Americas, for Dr. Aldiguieri? Thank you very much for your question. I'm going to focus more on age groups to give you my answer. From the time the first cases were detected in the region and up to April 20, 60 million cases have been recorded and almost 1.5 million deaths. During the first quarters of 2021, over 20 million cases were reported, including more than 500,000 deaths, again in the Americas. North America, including Canada, the United States, and Mexico, represent 59% of those cases and deaths almost too. And Central America and the Caribbean and South America is 39% of those cases. Regarding cases that have been reported, those people between the ages of 20 and 59 years of age are those who have been most infected. And 72% of all reported cases are in this age group. 72% then in the age group from 20 to 59 years of age. And out of this whole set of adults under 60, the most widely affected group has been the group between 30 to 39 years of age. Regarding the deaths in the region, the large majority of deaths have been reported in people over 60 years of age. That is 78% of deaths. And out of this set of patients over 60, the most widely affected group has been the group of over 70 years of age, and they represent 54% of deaths. But it is important to bear in mind that regarding trends in the Americas, from the very first weeks in 2021, we have seen an increase in cases, hospitalizations, and deaths in younger populations and adults in several countries. And we have seen a significant increase in cases in younger populations and in adults in Argentina, Brazil, Canada, Chile, and the United States. I hope I have answered your question from the colleague from Prensa Latina. Thank you, Doctor. The next question is from Uriel Velázquez from Despacho 505, Nicaragua, and other journalists, among them Amanda Palis from Suriname and from Mexico. And they ask about the date of arrival of the second batches of vaccine through COVAX, and also the journalist Valadez from Milenio. So what are the estimates of the date for the second batches of vaccines to arrive? Thank you very much. I know people want to know when and how much. As I said at the beginning, and let me repeat again or underline, we have concluded the first round of deployment. Two countries have already received a second deployment, El Salvador and Argentina, and we're working with the manufacturers so that all the other countries, and following the list that has been established, which we haven't changed, we cannot change to put one country ahead of the other, but just following with the list, then the expectation is to begin. And as I said, we've already begun with the second round, and we will continue with the second deployment round during the next week, and it will end at the beginning of May. And the third round will be up until the end of May. And with this, all countries in the region will be receiving vaccines corresponding to about 2.2% of the population. This is COVAX's estimates, but we should underline that at this point in time, a major manufacturer providing vaccines for COVAX, the institute in India, which manufactures AstraZeneca, there is suspension in their export of vaccines. So we need to be aware of this. We need to underline this because we are reporting to each country the doses or the dates and when they will receive. We are working 24 hours a day with the manufacturers, and it is very important to bear in mind that the vaccines that we are receiving from the manufacturers are provided directly and very quickly. So our expectation is to report to each country about the purchase orders that are already ready, and they have already been given to the manufacturers, and now we are just waiting to hear about the amount and the date when the deployment will occur, and then we will report back to the countries. Thank you. Thank you, Doctor. Now, a question from Kaylin Romero from El Diario El Confidencial from Nicaragua. And she says, the government of Nicaragua, does it have some agreement with PAHO to share detailed information about the amount of people vaccinated? And if so, is there any commitment to share data of all vaccines that are administered, or only about those donated through the COVAX mechanism? Dr. Ugarte. Yes, thank you very much for your question. There is not a specific agreement to share information, detailed information about the amount of vaccine persons, etc. However, all countries were requested to share their information on every Thursday of every week, and they were given a standard format on a spreadsheet to share their data, so that all the data from vaccines approved by WHO are being included in that spreadsheet, and that is uploaded to the PAHO's website. Officers from the country office and from headquarters have spoken with Nicaraguan authorities, and we hope that the information will be provided as the vaccine is administered. We should consider that information about the vaccinated population, the ages, the priority groups, the vaccination calendar, etc., goes beyond any agreements that countries may have with PAHO or with any other agency. It is information that should be transparent, and it is a mechanism that the population in the country needs, not only to plan for their vaccination plans, but to increase trust and transparency regarding the vaccination process, and to continue to implement the public health measures such as hand washing and disinfection, mask wearing, and physical distancing, which we should continue to enforce for the near future, as our director has reminded us. And please remember, we need to continue to protect ourselves, our families, and our communities. Thank you, Doctor. We are coming to the end of our session today. And then the next question is by Matias Lowy from Medscape in Spanish. It says, there are people who who can afford it and choose to travel to the United States, and their argument is they are releasing the countries of the responsibility to vaccinate them. His question is there any ethical objection to this? What do you think, Dr. Etienne? Thank you, Matias, for your question. And now I switch to English.
Absolutely clear that the main ethical issue that our region and the world faces now is that vaccine access has been so unequal. Everyone should have access to COVID-19 vaccines, regardless of where they live. Vaccines, as we know, are life-saving tools, and this should be available to all everywhere. But really, the reality is more complex than that. And in the face of supply shortages, we have urged countries to prioritize health workers and those who are most at risk of falling sick. Of course, there are many ethical challenges related to vaccination. And PAHO has a bioethics program that has been helping countries to address the ethical considerations in their public health decisions and policies. We have strongly recommended to countries that decisions about access to vaccines are made based on public health criteria. One's wealth, whether you can afford or not, your position in society, or your ability to travel, should not be a determinant for access or not to vaccines. But the inequality that we are facing cannot be addressed on an individual basis. We need to find collective solutions that are based on solidarity, which will allow us to bring vaccines to all corners of our region. And that's why WHO led efforts to strengthen the COVAX mechanism to ensure equitable access to vaccines, and that is urgent. Equity implies prioritizing those in greatest need. And frankly, Latin America and the Caribbean is the region that currently has the greatest need for vaccines. That's why we advocate that this region be prioritized with the distribution of vaccines. And we therefore call on all countries that have more vaccines than they need, to donate them to the countries that need them the most, particularly the countries in Latin America and the Caribbean, in the Americas, that have borne the brunt of the epidemic. This is a global epidemic, and as we've said repeatedly, no one will be safe until we are all safe. Thank you for being with us today again, and goodbye.
Muchas gracias, doctor Etienne. Ahora sí hemos llegado
Thank you, Dr. Etienne. This is the end of our briefing session today. I remind you that you can go to our PAHO website at www.paho.org and visit. There are updates there, and you can also contact us through email. Thank you very much, and we'll see you all next week.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.